Hi, I'm Jason Wasfy. I'm one of the medical directors of the Mass General Physicians Organization. I'm really happy to have a chance to talk with Melissa Chittle, Chief PA in Interventional Radiology, and Dr. Josh Hirsch, Vice Chair of Interventional Radiology. And I've, for a long time, really been fascinated by the work you all have done in shared decision making for port placement. We'd just love to hear more.
Jason, that's incredibly gracious of you to say, and we appreciate this opportunity. Interventional radiology is a place where we have forever sought to bring value to healthcare. And in reality, we've been working a lot on sort of wonky approaches to how to provide greater value through what we do. The opioid crisis brought in a great opportunity for us to apply actual medical decision making, which Melissa Chittle did in this sedation project. So I think she's going to tell us more, and I'm very excited.
Sure. So we've been using shared decision making and have implemented a decision aid in IR, and we present it to patients at the time of check-in for brief IR procedures like port placements. And basically the decision making part is a collaborative process where the clinician empowers the patients to select a treatment option that's consistent with their goals and values for the procedure. And the decision aid is a tool that helps with that as it presents the options clearly, some risks, benefits, side effects, reasons to choose or not choose it, and helps patients really clarify their goals and values. And the options we presented are undergoing a procedure with no sedation, just local anesthetic, versus minimal sedation, which is just an anxiolytic like a benzodiazepine, versus moderate sedation, which is a combination of opioid and a benzodiazepine. And what we have found has been really remarkable. As offering patients choice, we have seen us go from almost sedating 100% of our patients with moderate sedation to less than half the time patients actually choose that higher level of sedation. Furthermore, the impact on recovery room time has been remarkable, as post-procedure recovery room burden is much less when a patient selects the less sedation options. So we went from 70 minutes of recovery time to 17 minutes with just a local anesthetic, or 40 minutes with the minimal sedation.
Yeah, I think one of the things I find so fascinating about it is when patients get these choices, that they choose the option that actually reduces healthcare costs. You're improving healthcare, aligning it more with the patient's preferences, and reducing costs, which I think has been exceptionally helpful. And it also strikes me as a wonderful way, since Melissa, you led this as Chief PA, how physicians and physicians' assistants and nurse practitioners can work together to improve the quality of healthcare here.
Absolutely. It's been a great collaboration. We'd have to just give our thanks to the Health Decision Sciences Center, who's trained all of us in how you create these decision aids and implement them and evaluate them over time.
Right, and you wrote a paper about it. So not only two papers, sorry. Yeah. So not only kind of improving the quality of care, reducing costs, but also furthering our academic mission, which is so critical. I mean, we really at Mass General want to be not only good at population health management in terms of reducing costs and improving quality of care, but also showing the rest of the country through academic publications how what we've learned and how we can improve the quality of care. So. Yeah, thank you guys so much for coming.
Thank you very much.
Thank you.
Appreciate it.